Alright guys, so I just wanted to do a quick video for you. This is what I will use as my portable urgent care. These are the Walmart Heart brand tool organizers. Milwaukee's got their own pack out version that are probably more durable. But this is what I use. And this is what I'll take for anything like an FTX, some kind of a prolonged op that we're doing anywhere with a base station that I can set up a BAS or an aid station. I could treat quite a few people out of the contents in this guy. We'll get into it, but this is kind of transport mode. This is what it's looking like, and it's kind of cool because all of these little tabs mean that they can come apart. So they'll lift off, and they've got a little handle. When I'm trying to move it around the aid station, if I need to, it can all just be in a vertical mode there. So then I'll kind of show you what it looks like. Once we get there and get set up, we'll get into some of the contents. Alright guys, so this is what it would look like set up in a BAS. These two are more of resupply and things I'd use less often. These are the ones I would use more often. So coming over here, I am getting over a cold, so bear with me. I really like these because these are their drawers, and I really like them because they keep everything super organized. So coming over here, I've got vitals, diagnostics, then we come down, we've got boo-boos, sutures, OTC meds, and this one is ortho miscellaneous. And that is, if you know, you know. Shout out to the homies. We'll come back up here. So the first thing I usually want to know about somebody when they come in, vitals. We'll get to this stuff. These are just some Velcro patches that I've got on here. These are just some random passive IR patches I had that went on there. We took those off during an event where the opposition had nods, so we took off all passive IR shit. This is actually kind of a sentimental thing that was given to me by a dude who did really cool shit with his career and gave it to me after some stuff had happened, and it's kind of a sentimental thing to me, so I keep that on there for him. Coming over here, first thing I want to know is the vital signs. So we busted open stethoscope, adult large blood pressure cuff. I use the Welsh Allens. That's what I've always used pretty much for my entire professional career. Welsh Allens, and this guy just pops off. Let's see if I can do this one-handed. This guy pops off, and then you can put it onto adult regular, child, and then I have somewhere in here, I have a small child, but I rarely use that one, so it's kind of buried. As you can see, gloves at the ready, some hand sanitizer, a barf bag, a couple of chems, an N95 for influenza or something like that I don't want to get, some iPro, temporal thermometer. Buried somewhere in here is there it is. Is a standard thermometer, core temps and whatnot, and just a good old-fashioned Petzl headlamp. Come over here, is my pulse ox, and some scissors. Looks like. Yeah. So everything I need to get a full set of vitals. Right off the bat, first drawer. And I really like these systems because it makes it feel like work. Like when you actually work in healthcare, everything just fucking organized, and yeah, it just gets me all hot and bothered. I love organization. So up here, this is my diagnostics drawer, and in here I do have a notepad and pen, a write in the rain and a pen, so I can start taking some notes. But these are my diagnostics. Gloves, extra N95. I practice what I preach. So this is my EMRA urgent care guide, and a Ziploc to help keep it weatherproofed. Often overlooked suckers and stickers for kiddos. kiddos go crazy for stickers and suckers. So it's always kind of a trick of the trade. Keep some of those for the kids. If you have to do a strep swab or something like that, sometimes you can bribe them. Wet ones, these are the antibacterial, kills the 99% of germs, bullshit. Keeping your workstation clean in between patients, it's pretty important. If you're seeing a upper respiratory influenza patient, and next up you're seeing ankle pain, trying not to give your ankle pain influenza is awesome. So something to clean the area. And here I've got an extra Right in the Rain, some Sharpies, earplugs if I've got someone that I've got on bed rest or whatever, just kind of help them get some more rest. Back here I think we've got pregnancy tests. Those are some pregnancy tests. There's a tuning fork. Over here I've got batteries, and so this is my otoscope. I have my ophthalmoscope attachment somewhere in here. Where did it go? Here it is. Ophthalmoscope attachment. So Welsh Allen again is spendy, but they're kind of the gold standard. Glucometer, keep it in here with lancets and all the things I need. Urine dips, the Siemens multi-sticks for urinalysis, or point of care dip urinalysis. Extra batteries for my Dr. Mom if the Welsh Allen goes down for some reason. These are just fine otoscopes. They work just fine. VS17 panel. I have a white cross taped on here, so wherever we're setting this up, I'll fly this outside, or if I need to, I can fly it off the side of this with some duct tape. But it basically lets guys know where to come for care. Whatever your thoughts are, these are widely available. It's just a COVID-19 rapid antigen test. A little flashlight, tick remover, some surgical masks if I've got a coughing flu patient or something. I'd prefer not to get the flu. So that kind of wraps up my diagnostics here, I think. Let's see, I've got a reflex hammer, gowns, if it gets really bloody, got gowns. And you're going to have to bear with me because I'm going to put this crap away as we go, because I don't want an enormous pile of shit on the floor when we're done here. It'll take me an hour to clean, so we're not doing that. Cleanliness, right? Keeping shit organized. Be a professional about it. So we'll kind of get into this. It's kind of tricky with one hand, but let's see if we can do it. So coming down, this is my boo-boo section. And actually, I'll tell you what, I'm going to scoot this forward here. Drop this handle. So this is boo-boos. Open it up, boom. Gauze pads, boats of gauze. Stuff you'd need for just random cuts, scrapes, abrasions, preparing to get stitches on or whatnot. And over here, all sorts of band-aids. The big band-aids, small band-aids, fingertip band-aids, every band-aid we can imagine, some Tegaderm. Back here, just a quick thing of Dermabond and finger condoms. I call them finger condoms, but they're basically the little finger band-aids that it's like a finger of a glove. So if you cut your finger and you gotta go back to work or you do food service or something, you'll see those there commonly. Here, some different kinds of Coban, different sizes. This is, I think, is actually vet wrap. Equine, yeah, so horse wrap. It's the same stuff, it's just a fraction of the price. More wrap. Gauze pads. This is an extra thing of quick clot. Hemostatic dressings. Non-adherent. I think these are 3x3s, 2x3s. What are these? 2x3s. And I keep one gauze pad just up front. It's just a quick grab. Put some pressure on something. So these are kind of the Band-Aids doing the work. Over here is some prep, alcohol prep pads, bacitracin. Keep bacitracin over triple antibiotic because one of the 3 ingredients in triple antibiotic is the sulfa drug, and a lot of people are allergic to that. Not many people are allergic to bacitracin, which is also one of the 3 ingredients. So I just do that instead. Another thing of hand sanitizer, peroxide, and some wound rinse. The boo-boos will let me deal with most minor lacerations and whatnot and get a guy back to doing stuff. You know, we've just got depth in here, so a lot of 5x9s, 4x4s, non-adherent pads, Coban, pretty much everything you need for minor lacerations and whatnot. I really love these because of how easy they are just to pop off. The next guy here is suture. Come up in here, suture, right off the bat. So you can see I do have some sterile suture kits. I have some extra instruments. Got stuff for cleaning. Bunch of 4x4s because you're going to go through way more than you think. This is pretty much the center section is just my grab and go. These aren't the greatest. The tools kind of suck on these pre-made laceration trays. I prefer the autoclaved, German gold handle. It says made in Pakistan. Usually they're kind of shitty. It says made in Germany. They're spot on, good shit. So I have those. I have some autoclaved. I have some that are in baggies and whatnot. Further in here, we do have an S-bit stove. I do have a little mess tin. So if I have access, I guess I do have access. So if I want to sterilize instruments, all I have to do is get my little S-bit stove out, get my mess tin, boil them. In here, capabilities to boil instruments prior to using them, spot on, because I can't carry an autoclave in here. Cleaning, some loose sutures. Like I said, this is pretty much everything I would need for one setup. Some iodine scrubs. And then below here, sterile gloves, some drapes, fenestrated drapes, non-fenestrated drapes, all that good stuff. Those are my 4x4s. And here, stuff for some irrigation. And then the bulk of my sutures. All the different kinds of sutures I would need. This guy has my needles, some lidocaine, all that good stuff. And over here, some meds for numbing, steri strips, non-invasive wound closure, some Close-X strips, some wound packing, dermabond, staplers, staple removers, tincture benzoin if you're going to use steri strips, more dermabond, more iodine, suture or staple removers. Everything you need for invasive and non-invasive wound closure. It's so cool, I can just grab it and set it over. Coming down to this one. These are medications. This guy here, you just open it and bam. Again, I love the organization. Over-the-counter pain meds. These are kind of my creams. Everything you need for a cold is in here. So cough drops, Dayquil, NyQuil. I like caring for the whole patient, not just the medicine side of the patient. I believe that how the patient thinks impacts how the patient feels. So if they feel like they're being taken care of, they're going to feel like they're taken care of, and they're going to have better outcomes. So in that vein, besides cough drops and whatnot, I have tea, and I do carry some other feel-good stuff. This is something that was handed down to me by a senior dude. and just a couple things. One of chicken bouillon, one of beef bouillon. In the in the staging area before they would be admitted, a lot of times patients would go to the observation unit, and in there they had the best food in the fucking hospital. And one of those things they had was the bouillons, and the nurses the senior nurses took me back there and showed me where all the good shit was, and basically how they survived, how nursing school was survived. And you would bring in your food that you could bring if you're broke as shit, and how to make it taste better. And the bouillons were one of those things. So I carry bouillon, I carry tea. Your Ricolas, Sudafed, emergency, all the things you need for a cold. So if I can make a guy operational just by, a little pick-me-up, a little something to make him think he's feeling better, I'm all about that action. As a medic, part of your job is to play mom. Some guys are hard as fuck, and they're your MARSOC, your SOIDCs and whatnot. I'm not that guy, but I've treated a lot of fucking people, and this is just what I do. So right, wrong, or indifferent, this is how I roll. Continuing on with that, this is just some temporary filling replacement. But over here, I do keep a thing of whiskey. I think this is some shitty Fireball that I had laying around. If you don't have true analgesia for a procedure, you're reducing a finger or something, and they can't have lidocaine for whatever reason. Sometimes you got to go back to the old ways. Give them some, big swig of whiskey. Some medicine cups. I've got a pill crusher, pill cutter. Lifesavers, some Afrin, and behind here some pill baggies, so I can take a pill baggie and give a guy, X amount of Tylenol, tell him how often to take it, and just give it to him, so I don't have to give him the bottle. Got some Vicks, Afterbite, I think this is bug spray, lavender oil, just some, I do carry some homeopathic stuff, whether or not it actually has any true value. Kind of up for debate, but that's just what I do. You guys take care of patients how you see fit. This is just how I do me. Coming back over, so we've got cold. Over here we've got some eye drops, different kinds of eye drops. Because I tell you what, a guy suffering from allergies that has to keep rubbing his eyes and can't see shit, he's a no-go. You can't do anything. So, quick thing of eye drops, just toss them to him, he's good to go. Some Flonase, 24-hour allergy, Benadryl. This is kind of your GIGU. So, we've got a couple of liquid IVs, some Zofran, loperamide, Pepto, stuff like that. This is your pain, Tylenol, ibuprofen, and this is your extended release Tylenol. And again, creams, all my different creams. Vaseline, anti-itch cream, burn cream, Meta Honey for some burns. We use that a lot at the burn center. I do have triple antibiotic if there's no sulfa allergy. Any kind of cream you need, I got it. Athlete's foot cream, whatever. And we will pop this last one here. Set it to the side. Here, this is ortho and miscellaneous. Up front, I have my Foley. I do keep a Foley. Hopefully we're not using it, but I do have it. Elephant ear for washing out ears if it's impacted earwax. This is like my junk drawer as well, so extra 2x2s. I do keep a little light around. It's pretty handy. Extras of keeping clean. This is stuff for bedridden patients, sponge baths and whatnot. Here we have hot packs, cold packs, hot hands. Keeping in the theme of ortho, I have a shit ton of ace wraps in here. Down below, I've got SAM splints, ortho glass, durable medical equipment, like your braces and whatnot. So I have lefts, rights, all sorts of variations. Anything an urgent care can do, I can do. I do keep an extra litter in here, soft litter, and a regulator for oxygen. And some extra oxygen stuff in there that you don't need to hang out or to see hang out in here. Alright, now bear with me. We try and get to the other two. Hopefully this works. Alright, that was a little bit too much to handle with just one hand, so we did have to take a quick break. I tried to do it in one take, but it didn't work. So this bottom one we just covered. Ortho miscellaneous kind of junk drawer. Coming up here, we've got my reference guides, wound closure extras, IVs, burns, ears, nose, and throat. And this guy down here, extra meds. I do have a nebulizer in there and some tubing. And all of this, like I said, does come with the handles and can be moved around with a little wheel system. So, pretty convenient. Reference guides, got a couple extra guides, antibiotics guide that I recommend, ortho guide, shipwreck manual from my time in the Navy, some quick notes, you check what's going on with them, we use these at the trauma center. These are kind of a cool thing that one of the docs I work with gave me. These are some anatomy and physiology cards. Let's see. If you don't have access to cell, you can't figure it out. Sometimes it's nice to have a reference. So I just hole punch these and through some cordage. And I've got a pretty robust musculoskeletal set of references. We're here, Ottawa ankle rules. Whether or not you're going to need an x-ray. Nice little references to have. Miniature Snellen chart. Some old notes for Right in the Rain, and then just an extra little note card. Let's see if we get those. There, trash bag for actual trash or other purposes. Keeping your area clean. This is my Espit stove that I said earlier. I just put in some pantyhose to help quiet it down. More 4x4s. And in here, again, this is my extras for wound closure, some ears, nose, and throat. We do keep some stuff for burns and IVs in here, but these big ones do get a little unwieldy. This guy you can also use to boil instruments if they need to be a little deeper in there. Throw water in that guy. More 4x4s, more Band-Aids, more tape, more tincture benzoin. This is kind of like an extra suture kit here. More Coban, peroxide, a bunch of sterile water for flushing. Down here, I have some IVs. NS, LR, got all the fixings. I usually, it's buried at the bottom, but usually I just tape the start kit and the actual angiocath to them, so I have it all there. Extra Dermabond. If you don't have Dermabond, I highly recommend you buy it, or the super glue. Please do not buy Gorilla Glue, like the foaming kind, because it foams on contact with water. Blood is like 90% water, and that really sucks to get scrubbed out. I've done it to people, and it looks horrible. Burn gels. You get them through Burn Tech. I think you get these through Medline. But just a bunch of burn gels. More wound spray, eye wash. I do have some extra suture kits in here. Some extra non-sticks. Pretty much just everything I need to refill drawers up higher on top of my my IVs and burns. And let's see. Oh, wait. Maybe it'll work. Bear with me. This last guy here is another kind of junk drawer, but these are some meds that I carry. Again, you can never have too much gauze, so I keep gauze everywhere. Non-sticks, gauze, 5x9s. These are some extra meds, injectable meds. This is that smaller mess kit I was talking about, using to sterilize instruments. Here we have a sharps container. Some albuterol, some more GIGU stuff. If I don't have to give them an IV, then I can give them liquid IV or electrolyte tablets or something. I'd much prefer that. Nebulizer stuff and tubing. Here's my nebulizer. Tucked down there. You can get those off of Amazon for fairly cheap. Got some extra cough cold stuff. This is my personal med, injectable, stuff like that you don't need to see. These are my little party bags that I use to mix up meds if you want to do dirty yucky or something. Here, more neb tubing, neb stuff. I do have some urinary stuff, some AZO and whatnot. I do have prescription meds like stuff for UTIs and whatnot, but that's in the prescription section that not everybody needs to see. Come back over. And I think that just about wraps it up, guys. So I need to do some work putting this one back together, it seems. But that tower is kind of collapsible here. So you can see that it gets pretty short. But in here I can treat quite a lot of people. Quite a lot of people for a bunch of different ailments. Highly recommend this system. If you have a base camp or you want to run this out of your house or your garage, however you're planning on being a medic, I highly recommend this type of system. It's not as portable as a bag, but I can treat far more people out of this setup. Really not that expensive either. Highly recommend it. Super organized. Hope you guys got something useful out of it. Other than that, we'll see you next time. Take care.